Hi, Dr. Brian Reagan, plastic surgeon at CosmetiCare. Today we are going to talk about one of my favorite topics, facial rejuvenation. This is a 53-year-old, very beautiful patient of mine who came in and she had several complaints. And this is pretty typical of what we see. First with her eyes, she was starting to get heaviness above her upper eyelid. And she also had some laxity and some irregularity of her cheek area. She had done fillers before, never liked the fillers, and wanted to correct that. Moving down into the mid-face and the lower face, we're starting to see some jowling. We're losing the definition of the lower mandible, and then there's crepiness of the neck. When I see a patient, I talk about facial aging. I say there's three things that come together. Number one, we talk about the skin and the quality of the skin and any laxity of the skin. Number two, we talk about loss of volume, and number three, we talk about laxity. So those are the things that are going on with her. We're gonna get the video to go, and we're going to talk and watch this video at the same time. So we put the photography up in the OR, and I review what my plan is. I review my photography in depth. I have a good vision of what I'm going to do with the patient, and then when we get the photography, I study it so that at the time of surgery, I know exactly what I'm going to do. Patient is going to sleep, and then we do some prepping of the patient. We trim some hair. I do some markings. These are all guidelines for me during surgery, and you see what I'm doing. The girls will braid the hair to get it out of the way. And then we prep. We've got a wonderful team. So, fat. So one of the key elements of this is to restore volume with fat. I love to take the volume from the knees, and I use a system called AcquiCell that I think allows me to get wonderful fat. My take rates of the fat are excellent, and so there's different ways you can harvest the fat, and there's different ways that you can process the fat. This is the AcquiCell technique. The fat is being collected here, and then we use gravity to let it separate. Now you see me performing a upper eyelid surgery, and so we're marking and we're performing, working with my scrub tech. It's so much fun. One of the things I love about plastic surgery is the immediate gratification I get. And surgery is, you get immediate gratification right away. We make marks, we do the surgery, and then you see exactly what you're trying to accomplish. In many cases, you see it right away. Yes, there's bruising and swelling, but you get to experience your work right away. I'm trimming some skin and some fat and putting in some sutures. Here's the fat. So now we've waited and the fat has separated, and we will take that fat, transfer it into a larger syringe, and then from there we transfer it into smaller syringes, and you can see me now injecting the fat. And I put about 50 cc's total of fat in her, and I put it in her lower lids, in her cheek, in her malar area, the medial cheek. I put fat in her forehead. So I love the rejuvenating properties of fat. It is your own tissue, it is biologically active, and we use a lot of it. So there's three things that go into successfully using fat. It's how you harvest the fat, what size particles you're harvesting. It's how you process, and then it's how you put it back in. And so we've now finished the fat grafting, and now I'm doing the lower face neck. I've already done the eyes. So my lower face neck lift starts with, we put in a numbing solution. It starts with the central neck. And I make a small incision under the chin, and then I remove some tissue to create that nice angle, and then I bring together the muscles of the neck to get rid of the banding, the platysmal bands, and tighten that neck so you have a really great angle there. And you can see me doing that. Again, working with my scrub tech. And so it's a small incision that we're able to do this, and this is the suture. You can see that that's tightening the muscles of the central neck. Then we do a dissection around the ear, and we dissect the skin of the lateral cheek and then of the lateral neck, and we communicate that with the central neck. I like to do that because it allows me to redrape more skin and get a tighter neck. Not everybody does this technique. Not everybody does as much undermining. I am not a fan of mini lifts because you don't undermine as much, and then you end up pulling the tissue under more tension, and I'm against that. I think you get bad scarring. I don't think you get a good result. So here you can see me doing wide undermining of the skin, communicating it with the central neck, and that allows me, in my hands, to get the best results. And then there are a lot of different types of facelifts, and what I can tell you is I do what's called a deep plane facelift, and it's a bidirectional. By that I mean that this deeper tissue is called the SMAS, and the elevation in the cheek goes up and the advancement in the neck goes back or lateral. And so a couple of keys. Number one, it's a deep plane facelift. I think that's better. I think that while technically might be more challenging, I think you get a better elevation of the tissue, and I think it lasts longer. And so that's what I do. And I think that that allows me to just deliver really great, wonderful results, very predictable, and very long lasting. So not every facelift is the same. In my hands, I'm doing the kind that I think look the best and last the longest. So a wrap up with facial rejuvenation, there's three things that are important. There's changes to the skin. I often am doing dermabrasion around the mouth, or we're doing laser resurfacing. Number two, loss of volume, big proponent of fat grafting. We've got a great system for that. Number three, and this is really exciting, is how to deal with laxity of the lower face and neck. I still think in my hands a lower face neck lift is the best way to go, but we've got some exciting technology. The Face Tight with Morpheus 8, and that's using radio frequency to tighten laxity of the lower face and neck for people that are either too young for a facelift, don't want a facelift, or maybe they've had one, they want a little bit of tightening. Bottom line is we've got all the tools here, and we've got the expertise here at CosmetiCare. So if you have questions or are interested in facial rejuvenation, come see me.